Hi everyone, in today's video we are going to talk about how to start physical examination cases in AMC Clinical exam, especially for online exams. And I'll be talking about the basic steps only. I'll not be talking about any cases. In the future we'll be practicing some cases, we'll be discussing some cases. The other thing is, as you may have noticed, that I have been making these videos for the last few days or weeks, and mostly people have liked these videos and they have given me feedback, and I really expect those feedback and those comments because it helps me understand what I need to work on, what I need to improve, and what part need to be polished more. The other thing is, if you think these videos are helping you, please subscribe to the channel and let your friends know about the channel. It motivates me a lot to make more videos and make more regularly. Now let's talk about the physical examination cases. Everybody has their own mnemonics, their own steps, their own ways of doing these physical examination cases. For myself, I have prepared this mnemonic called Swipe C. So how I start is, first I comment on the stability of the patient, then I talk about the rest of the things. It's really important that the patient is stable enough to proceed through the rest of the examination. And that's why I always start by commenting on stability first. And that just gets one thing out of my way. After that, the next step that we all do is we wash our hands and wear the gloves. The third step is we introduce ourselves to the patient. Now, while introducing ourselves to the patient, what do? We have to tell the patient our name and we have to tell them our position. We can also tell them what examination we are going to do, and we need to check their ID to make sure that we are examining the right patient. Now remember, what I'm telling you right now is what I'll be telling the medical student as well. So remember, you are teaching the medical student about this. That's why you can do it in the same way I'm doing, or I'm trying to do right now. So the next important step is offering the painkiller. Now, how do you do this, or how do you explain this to the medical student? What you have to say is, you first ask the patient if they have any acute discomfort or pain. If they have any pain, you ask if they need painkillers, and you offer them painkillers after ruling out the allergy to the painkiller. Now, this point is important, and this shows that you are aware of these issues, that some patients can be allergic to some medications and you don't want to give them the painkillers if they're allergic to that particular painkiller. So it just takes you a fraction of a second, I think, just to include this point, but this can show that you are a safe doctor. So that's the painkiller point. Then you move to the more important part, and which is explanation. So regarding explanation, again, people do it in different ways. I have just tried to summarize the important things about explanation for different cases here. So let's have a look here. I tend to call it a pep talk, just to help me remember the steps. So pep talk, or PEP, stands for position, exposure, procedure, and permission. So what we do here is we first tell the patient what position will be required. And this way you will never forget to include position in your explanation. Generally speaking, if you can imagine like this, your patient is standing, your patient is sitting on the bed, your patient is reclining, and your patient is lying flat on the bed, you'll be able to remember the position required for most of the examinations in our exam. So standing position is mostly done for hernia examination or examination of the conditions related to leg of the patient, and you may need to modify it according to the cases. Then respiratory examination you do in the sitting position, CVS examination you do in the 45-degree reclining position, and then abdominal examination you do it with patient lying flat on the bed, and preferably with the hip and knee flexed, because that flexes the abdominal muscles, that relaxes the abdominal muscles, and it becomes easier for you to check for organomegaly. After that, you talk about the exposure. Again, exposure required for different examination is different, and you may need to do it on a case-by-case basis. But generally speaking, if you are doing abdominal examination, then in that case, what exposure do you need? You need exposure from nipples to symphysis pubis. So your keywords here are nipples and symphysis pubis, and that's what you need to include in your explanation. And when you are doing CVS in respiratory examination, you need exposure up to xiphi sternum, and that's your keyword. If you are doing genitalia examination, you have to do it below the waist. And if you are doing breast examination, you have to do it up to the waist. Sorry for the spelling error here. It should be the one like here. So anyway, so this is how you make sure of the exposure. And then after the exposure, you have to explain the procedure to the patient so that they understand what is going to happen. So how do you do that? Let's talk about that for a moment. Procedure and permission. So regarding the procedure, a general approach is most of the examinations are done by look, feel, move, and listen, right? So this is what you'll modify from one case to another case. Don't try to complicate this part too much, and don't try to explain this part too much. You simply tell the patient that, then let's say that I'm doing a respiratory examination, then I'll look at your hands, your face, and your chest and its movement. Then I'll try to feel the movement, and then I'll listen to your chest, especially listening for your breathing sounds as well as your heart sound. In this case, because the patient does not have to do any kind of movements, that's why I did not include that in my explanation. And then I make sure that my patient understands the procedure. I'll check if they need a chaperone or if the case requires a chaperone, and then I ask for the permission to proceed with the rest of the examination. Now, regarding the chaperone, what are the cases in which we need chaperone? Let's briefly talk about that. So this is the guidelines I have got from the RSCGP Standards for General Practices 5th edition. And as you can see in this guideline here, these are the conditions in which you should offer chaperone to the patient. And one important thing here is if you're examining a new practice, new patient to the practice, you have to offer chaperone to the patient. This is really important. And the other important thing for us is child. So in any cases of pediatric examination, always make sure that you offer a chaperone. In this case, the chaperone can be parents as well. Remember, parents or relatives or friends can be chaperone for patients, but when they are the chaperone, ideally we should be explaining to them what is the risk of someone from non-medical background being a chaperone. But for the exam purpose, we don't need to do that. We don't really do that. And any time you are requiring any intimate examination of child, you offer a chaperone. But I would say that in any pediatric cases, just offer chaperone just to be on the safe side. If you're examining a patient of different gender, offer a chaperone. When you're examining a patient's private parts, then also offer a chaperone. When you're examining a patient from non-English speaking background, you have to offer a chaperone. So just look at this table, pause the video and try to see what are the conditions in which we need to offer chaperone. But for the exam purpose, what you can simply say, if you're not sure is, then I will assess the need for the chaperone and will offer one if needed. And with that, I will proceed with the consent and the rest of the examination. So this is one clever way to handle this issue. If you're not really sure about chaperone, just say that I'll consider the need for a chaperone and then I'll offer one if needed. So that way, at least the examiner knows that that in Australia, it's a standard practice. Internationally, it's a standard practice that patients need chaperone in certain conditions. Okay, so these are the steps you go through when you are doing physical examination cases before you start with the actual physical examination. I hope this makes things a little bit clear for you now. And if you have any comments for me, if you have any feedback for me, please let me know in the comments. And if you want me to cover any particular physical examination case in my next video, please let me know. Until my next video, keep practicing and all the best.